are here because we are patriotic Americans who only want the best for our country. But every day, we see troubling signs of a leadership that not only doesn't share our values, but is hard at work to destroy them. Okay? With expansive government policies such as higher taxes for redistribution of wealth, government health care, eliminating choice, delivering ration care, and counseling seniors on how to end their life. We cannot let this happen. We have a culture of death in Washington, and it has to end. They're also trying to pass cap and trade, imposing taxes on businesses that will increase consumer costs across the board, weakening immigration controls and gun control, stripping you of your constitutional right to own a handgun. It has to stop. So myself and Jeff, my co-organizer, we decided we have to alert the rest of Long Island to the challenges we face so you too can be a force in fighting this expansion of government and assault on our freedoms. You must be vigilant about contacting your representatives this month. They are home. They are in their district offices. They are here. You have to call for town meetings with them. Okay? While they're in their home offices, you must call, go to their offices, talk to them, tell them you do not support, and they must not support any part, any version, anything about Obamacare. Period. Nothing. And if they do, they will be thrown out in 2010. They will be gone. Before they left on Friday, the Energy and Commerce Committee voted the bill in, okay? They voted it, okay? Now what's going to happen, Pelosi, Reid, and Obama are going to be twisting arms when they come back in September to keep it alive. We want it dead. Dead. Okay, we need reform. We need reform. We don't need or want a single-payer system. But the Obama-Emmanuel strategy is to make the public perceive things to be at a crisis level, so they have the mandate to fix it. We know this because Emmanuel told us. He said in so many words, never let a crisis go to waste. He warned of the perils we would face if not for the stimulus. So tell me, has unemployment stopped rising? No. Did he create jobs? No. Oh, I'm sorry. He had to backtrack and recalibrate his words, just like he did with the racial comment, okay, to reflect what is really happening. If he's lucky, he can claim he saved some jobs, maybe saved jobs. And then he wants to take credit for a recovering economy when there's no reliable indicator to support it. There's no reliable indicator saying that our economy is recovering now. So, are you feeling comfortable with handing over all of your health care, okay? Something as personal as your health care to an out-of-control, crisis-mongering, dictatorial regime? I don't think so, and I don't blame you. Let's talk about the realities of a government-run plan, something Obama knows little about. He doesn't know anything about realities. Obamacare is not about keeping you healthy or about care when you're sick. It will complicate your sickness if it is enacted because it will add layers of bureaucracy between you and your doctor. It will create longer wait times for appointments, and it will make it harder to get necessary tests. In other words, care will be rationed. You will not have the freedom you do today to be in control of your health care. Remember those words. You will not have the freedom, and you will not have the control. They will have the control. You probably don't run to the doctor for every ache and pain. You monitor yourself and your ailments, okay? And if they get better, you make the choice to go to the doctor or specialist if you want. Today you can get a prompt appointment. Under government health care, you may have to wait months. Do you want these choices taken out of your hands? No. Do you want them taken out of your hands? We do need reforms. in the healthcare system. We have spiraling costs in healthcare for many reasons, but a government-run program is not going to lower the costs. And that was already determined 2 weeks ago by the Congressional Budget Office. The costs are going to continue to rise just as they are. There are those who abuse the system by using emergency rooms for basic care, regardless of cost. That's one abuse. Doctors have to pay outrageous premiums to protect themselves from lawyers and lawsuits. There is the increasing drain on the system of legal and illegal immigrants. The inescapable truth is that we are all guilty, okay? That we expect every aspect of health care, WellCare, to be covered. That was not the original intent of healthcare. We need to reevaluate what healthcare is all about, what it should be. We should consider the proposals that call for covering long-term care, catastrophic illnesses, and put more responsibility on the individual when it comes to standard care, routine physicals, common colds, and short-term conditions. We need to look at the costs more closely for the purpose of addressing each for its role in inflating the costs. Taken separately, there is much to uncover when we do this and learn before we know exactly how to fix it. Fixing it is key. Destroying it, Mr. Obama, is not. We don't want to destroy it. You must go to your district offices. You have to go to your representatives in person. Call them. Don't relent. You have to keep it up. This is the month. They will go back and they will tell you they have a version of health care. That is okay. There's no such thing. It's all Obamacare. It's all government run. It's all socialistic philosophy. We are Americans. We know better. We don't want that. You don't want that. Okay, this event is about healthcare mostly, but it's also about the expansion of government in our lives, which he's doing. He's hitting us with every day, quick and fast. That's his MO. We don't want any of the programs he has. I have some speakers here today to speak a little bit about our government, limited government, what it means, what we have to reacquaint ourselves with when we talk about limited government, know the specifics, be knowledgeable when you speak to people about it.